I am so excited to have Wilma here to introduce you to Wilma Rice. She's already behind the scenes gotten involved with our coalition, with our medical school consortium. She's going to be talking to them. There are so many things that are exciting about what she's doing and what she's done. And so I'm excited to jump into it. As I think Virginia just shared, Wilma, a nurse by training, is senior educator with My Life, My Choices, and is CEO of Professional Medical Trainers. And there's so much with our coalition in terms of educating providers, talking about advanced care planning. She was instrumental, and her group, in getting their South Carolina post legislation, physician orders for scope of treatment, their law signed in 2019. So I want to be quiet. I just want to turn it over to Wilma and say welcome. And before we dive into what you're doing now, give us a little background. Tell us about you and your background and what has shaped your career path.
Well, I've been a nurse for 45 years. Started as an LPN, gone back to school a few times, and have my master's now. I've been a certified nurse, certified emergency nurse since 1988. And they just kind of grandfathered me in. I don't have to pay dues anymore for that. But I worked in the emergency department for 28 years. And that's where I pretty much got my passion for people in the state when they start dying. And what I really saw was that families fought about what to do with mom or dad. And to me, it's a hurt that doesn't heal in a family. And they have to deal with that for the rest of their life. So when I switched to professional development in 2007, my boss at the time, we were looking for a focus for me, and she put me in touch with the South Carolina Coalition for the Care of the Seriously Ill. And I've been with the group ever since. And they, like you said, we were instrumental. We pushed post for South Carolina. We had a work group that worked on it, and actually pushed it through with the legislation. So we're very proud of that. Great team working on that. And so I love what I do. I retired in March from my day job, so I have more time for this. And I just love what I do.
Well, all right, we're going to tease out some of this, and I'm sorry I went off screen just to get, yes, I was devastated. Virginia and I met you, I think Virginia may have known you beforehand, on your date of retiring. And we went down to South Carolina, and I was like, but I have so many things I want to ask Wilma. And then I heard you were retiring from your hospital job, but not from what I call our sister organization, the South Carolina Coalition for the Care of the Seriously Ill. And so they, I should have said you work very closely with Marisette Hassan, who was who's been a wonderful member of the coalition and who we just profiled and on our the last Friday facts. And I was like, but Mary said I want to talk to Wilma more. And she said, oh, no, you can pull her in. So a little bit more, I want to dive in a little deeper, your movement from emergency department into education. Where does that what really motivated that, and how do you feel leaving the clinical space and being in the educational space?
Well, 2 back surgeries was a big motivation. And the fact that I saw a lot of new nurses coming through, and they needed help. And I had one of the best mentors ever when I started out. And I wanted to help young nurses really learn how to take care of people, not just do things and do procedures, but how to really get into the caring part of nursing. So I felt like I could do that through education. And I love to teach. And I'm kind of old-fashioned with it. And when I talk to someone about lab values, say if I'm teaching class on lab values, we're going to talk about how it affects the patient and how you can help them through what's going on. And when I started with the advanced care planning, then that passion came over with that. I love taking care of elderly people. And, you know, we think of advanced care planning with the elderly a lot. So it's all kind of gone in succession to where I am now.
Well, I would say that's a beautiful transition, though I didn't love the back surgery part, but
Yeah.
and amazing to hear your focus on mentorship and supporting your colleagues, both the current and next generation. I think that's a passion of mine as well, even though I'm not in the clinical space, and so I love to hear that. So then your work with I always mess up the name of the South Carolina because it's so interesting. It's similar to North Carolina Coalition for Serious Illness, but it's the Care for the Serious Ill. You did chair the education committee. I know our group will be interested. Tell us about the education efforts, and then in a second, we're going to really dive in deeper to your education with providers. But what does that mean, the education committee for the coalition in South Carolina?
At the beginning, the education committee was all about, it was very loose. All right. The whole coalition's focus was on doing the post, getting the post through. And it kind of formulated, at first it was the post work group. And once we got the legislation signed, it's like, okay, we can't just stop here. And then we started broadening a little bit about where our focus was going to be. And one of the things that we did is sit down with the group, and we actually came up with 3 goals, and to help us kind of zero in on what we want to do. And it's one of the goals is that we want to get advanced care planning into at least one university or college per year. And everything we do goes towards that goal. And we have been successful with that. We've just started with the USC College of Social Workers. They're very interested. We met with them, and we're actually going to have some of them in our serious illness conversation instructor course coming up in May. I've been doing the MUSC medical students for several years now. And then we have a few other groups that are interested. And so that's one goal. And with diversity and equity, you start teaching, and then you start bringing things in, and you're not aware that you're bringing things in that may not be correct. So one of our goals is to make sure what we're teaching stays, is very inclusive. That what we teach, even though it's kind of like the serious illness conversation, it's a scripted course, but we want to make sure it's very inclusive. And one of the things we're looking at is how do we want to build our system of instructors? And we've been talking about maybe looking at the American Heart Association, how they work with their instructors, and also that it's we keep things going the correct way. And then we have things that come up. And one of the things that we're doing is a virtual symposium. We talked about that in our meeting before. We do have that coming up in early May. So we're trying to we'll keep with advanced care planning always, but we're looking at ways to make it better, if that makes sense. Mm-hmm. And with our goals, everything we do, because we want to stay on point, has to go with those goals.
So helpful. I'm like listening and making notes because that will be helpful for our coalition as well. Mm-hmm. I love the work when you and I spoke privately about what the work you're doing, and you just referenced it with your first goal with the medical schools. Mm-hmm. and really intentional work and breaking it up into what happens in each year. If you could just pretend you didn't tell me, because now you're telling a broader audience, tell us about the work and how that's evolved, and how you break it up for the students, because it's great.
Well, the MUSC medical students, they start in year 1 of med school. They're assigned a senior, someone over 65 years old, and they're tasked with doing things each year with those seniors. And in their 4th year of med school, their job is to have an advanced care planning conversation with their senior. And Dr. John Robb and I were presenting at the SCMA annual conference a few years back about our post-pilot and talking about advanced care planning. And after the presentation, Dr. Heather Boger came up to me and said, we need to talk. She oversees that program with the medical students. And she said that the advanced care planning part of medical school was the most traumatic to the students, to where some students cried. One person went to the dean and said, I just can't do this. It was very nerve-wracking to them. And she wanted to make it better. So she sent me what the curriculum was. And I could use respecting choices and serious illness conversation and kind of give some guidance. And we changed up some of the things they did. But we also started with 1st year med students. And we do just a short presentation on advanced care planning conversation with a loved one, not doctor to patient or anything, just between, say, a husband and a wife. And they were blown away. We do it from talk a little bit, and then one of my cohorts and I will do what we call the Twisted Sisters routine. It's 2 sisters. One wants to have a healthcare power of attorney. The other one is resistant to even talking about it. So we do that role play in front of them, and they learn some of the language they can use to overcome that resistance. And then they're assigned to go home and talk to somebody they love. It doesn't have to be a family member or anything, but talk to somebody they're close to about advanced care planning. And they're also encouraged to do their own advanced care planning. Now, other parts of that are that they meet in small groups and continue that work and practicing on it. Year 2, they come back and we actually have a symposium for them, a 4-hour symposium on advanced care planning. And my part, along with Keisha Graham, is that we do a panel discussion. And it's a very rich discussion because they come up with questions that have been bothering them about advanced care planning. And we can really get them to understand why it's important as a physician to have these conversations with their patient. And again, giving them language. And then we role play a physician and a patient having a conversation. And I think it's always interesting, you know, the meeting after the meeting is always the big thing. After we're finished, then that's when people start coming up and asking their private questions. And that has been so amazing because of some of the things families have gone through. This year, we had one young lady come up and said this, she was asking for her own family. She had lost a sibling, and now her parents will have nothing to talk about advanced care planning. They won't talk about death at all. And so she was asking for help in this. And so just helping them personally with it is, to me, very rewarding. And then for the 3rd and 4th years, they continue with their work groups and all. And in that 4th year, they have to have that conversation with their senior. And things happen in that time. One young man said that, well, my senior has been diagnosed and with cancer, I believe it was, and they're dying. Do I still have this conversation with them? It's like, oh my, yes, yes. So I think it's where we want the education to be, because the physicians have not been taught to do this. And we're just the first class that went through all 4 years of this change in education finished about a year or so ago. And I haven't gotten the feedback from if it was any easier for them to have the conversation. But in February, Dr. Boger said that it's time to start writing this up. So she's got the information back now. So I'm hoping to get those numbers and all pretty soon. And but you get really good oral feedback from the participants. And we're talking 180 students at each one of these.
Wow. I was going to ask anecdotally, how do you feel? Do you feel that, I mean, are any other students in their fourth year before this who were going to the dean crying, saying, I can't do it, which is shocking.
Yeah.
You feel that the students were embracing it in a way after the 40 years now, that they had more comfort?
I think they're more comfortable with it. That's my big hope. A lot of work went into helping them work with it even more. And My Life, My Choices also donates their booklets to them on how to have the conversation. And so we donated like 400 books last year, and for them to have something hands-on to do and to work with. And I'm encouraged by the interest they show in it. You're always going to have somebody sitting in the back that's going to sleep while you're doing it. But the questions that are asked are good ones. And like I said, the people that come up afterwards with their personal stories and questions, I think it's very encouraging. It at least gives them permission to ask that question. And I think that's a big opening there.
And I love the role play, the Twisted Sister role play. Thankfully, I was co-healthcare power of attorneys with my sisters, and thank you, there was no twisting around. But I think it's great that you showed that kind of family conflict and and how years ago I was talking with a social worker in the aging and hospice care space, and she said, I'm very comfortable around anger. And so having that, being able to sort of work around that and start to give them tools in their toolbox of how to navigate that, I think is wonderful. Did you, questions are starting to come in the chat, and I will, I'll bring them up in a second. I'm wondering about how you've moved that work, or if you've moved that work from medical students to, especially like the professors in the medical school, or to the broader provider arena. So you have a captive audience with the medical students. How are you seeing it with the providers who have been in practice for many years, whether it's doctors, nurse practitioners, social workers?
When we do like a serious illness conversation program, it's 3.5 hours with whichever clinician is there. And one of the beauties of that program is the materials that they provide for you. There is a whole section on how to meet resistance. And one of the scenarios is physicians saying something like, I've been doing this for 20 years. Why am I sitting here? And the knee jerk is, well, I know you've been doing it. Have you been doing it well? I don't think I would come out and ask that, point blank, but how to respond to that to really get them to trust the process and get some buy-in and not make them angry. So the serious illness program really helps you face all of that kind of resistance. By and large, the feedback from the instructors that are doing the 3.5 hour course, they haven't gotten that much pushback from physicians. Now, as far as instructors getting that broader, we get the class I have coming up in May for instructors. It includes nurse managers from oncology, nurse navigators from oncology. I've got several professors coming in, a couple from the USC Social Work College, because they're going to bring it into their curriculum. And that's more sustainable if they're doing their own instructions instead of us coming in and doing it. And so it is getting out there slowly but surely.
And you mentioned it quickly. I want to talk about resources. Talk about the, you base your work off the, well, you tell me, because I'll mess up the name. You're basing it off some national curriculum and guidelines. If you could share that with the group.
All right, the serious illness conversation program is what we do with clinicians. We have two models that we use. If we're teaching community, we use respecting choices. The first steps with that. Teaching clinicians is the serious illness conversation program. And this is out of Ariadne Labs. And we got tied in with them when we started our $1.8 million grant, and which was geared towards teaching clinicians and community. And Ariadne Labs sent Justin Sanders and Joanna Palladino down to train 8 of us initially. And we found out very quickly that 8 was not going to be enough. And part of our goal was to pretty much saturate the state. As an example, I'm teaching the class in May in Charleston, and I've just gotten to 10 people. That means I need 2 more instructors. So I'll put a call out to my list of instructors. And I know I've got a good many in the low country. I've got some in the Midlands that will travel to teach so that we can support each other. The ratio is usually 4 students to 1 instructor. And so I started being the instructor trainer here. Ariadne Labs at that point had not really planned for how they were, going to have more instructors trained. And so I talked with Justin and Joe and said, this is what I do. And so they kind of blessed me and said, go ahead. And so I do most of the training of instructors to go out and do the 3.5 hour and courses and try to support them with questions about teaching.
Well, that's great, and it's helpful. I know I'm getting learned. I'm getting educated on the different programs that are out there, and I think it's helpful for the folks listening. I know there's a number of different, or there's a few different programs, and I think there's some research starting to happen on which type of programs can be the most effective for different audiences. At this point, any and all. Some questions that, and it may have just been put there, I think, did Lori just add, there was a question about sharing the link for the virtual symposium in May, and thank you, Lori Librand, I hope I'm pronouncing that right. She just put the link to the symposium, and that's the upcoming symposium, correct?
Right.
Great.
And
great.
Following what y'all did, what we talked in the strategic planning, what you did in North Carolina, we decided instead of doing an 8-hour day, we were going to spread it out over 5 days. So we're doing quick hits in the morning. The first day is going to be a little bit longer than an hour, from 8 to 9:30. And that's going to be about burnout. And then the rest of the week is more of the 8 to 9 o'clock type things. So
that's exciting, because I feel like there's so much, and hopefully there's a lot more we can do across the state lines between South Carolina and North Carolina. And so I love that our virtual symposium helped to spur on the creativity. That's wonderful. I know we only have a few minutes left. I did want to, similar to what we have in North Carolina with our Mind My Health, the website that's looking at our advanced care planning efforts through SCSCI. There's some, you have My Life, My Choices. And that's a great website also, that if you want to speak just for a minute about, I know as we look at consumer facing websites, we have what we have here in North Carolina, but I was looking at it again yesterday. Wonderful resources. What's that? mylifemychoices.org. Make sure to have that S on it, or it's a completely My Choices about it's about trafficking in children. So anyway, mylifemychoices.org. Tell us a little bit about that with our minute there.
Well, that's how we branded our group, and the website, we wanted to make it one-stop shopping for anything to do with advanced care planning. So we have the consumer facing side, we have resources that link you to anything that you need with advanced care planning. We have started portion for just the professionals, and we're looking to build education. So right now, you should be able to go on that website and register for the virtual symposium. There's also education about our post. The person who used to run the website for us, he recorded me doing a 1.5 hour presentation on post, and then he broke it up into 4 or 5 different little modules, and people can go through that and learn about post and get CMEs. And so we're trying to build that to have more online education for people about ACP subject matter. And it's just anything you need. And instead of having to go out to another website to get this form or that form, we brought all the links to the different forms right to the website and tried to make it easy for people to do this.
Well, and I think with our 2 minutes left, let's talk about advocacy work. I have an advocacy announcement I'm going to make for us, but your efforts in 2019 to get the post signed by the governor. Tell us quickly about how that came about and what that included in.
Well, that was the culmination of years of work with the form, the format, and everything else. And we learned a lot about legislation. And we reached out to the different legislators to sponsor, got co-sponsors for it. The first time it didn't make it through, we went back to the drawing board on a couple of points and re-upped it for the next year. And we were able to get it signed into law. And it was one of the most rewarding things I think that the group has ever done, because they learned a lot. I know I learned a lot. In fact, I blame myself because it didn't pass the first time, because I didn't know how to testify at a committee hearing. And but I learned. It's just, people in healthcare don't do this enough, and they need to get involved with what's going on in the legislature, because we have non-healthcare people driving what we're doing, and we need them to listen to us. And so we need to have a voice in what's happening in our capital cities, and it can be done.
Well, those are perfect, wonderful advice, and a perfect segue that I do need to take a quick moment of personal updates for our North Carolina Serious Illness Coalition and our legislative activities. This Monday at 3 o'clock, the House Judiciary Committee is going to be talking about HB 739. That is the House form of the bill that we're looking at to modernize the advanced healthcare directives. It's in the Senate and it's now in the House, and we have wonderful talking points. I just saw that's going to be going around. Thank you to Shane. We have a great form that Virginia is going to send around for folks about that bill to advance the healthcare requirements, the directives requirements to be able to go from 2 witnesses and a notary to 2 witnesses or a notary and electronic filing. So for coalition members, you're about to get some talking points on that. Wilma, there's so much, and I know you've already been recruited to talk with our group that's looking at our medical school consortium here in North Carolina. Thank you for the work that you've done, and thank you for inspiring us and giving us literal tools and resources to work with here in North Carolina. And this is the beginning or the continuation of a wonderful friendship and not a twisted sisterhood, but a supportive sisterhood between North Carolina and South Carolina. Our focus on the serious illness constituents in both of our states. I really thank you so much. And you'll be hearing a lot more from us. So everyone get used to seeing Wilma, and Wilma get used to seeing us.
Well, thank you for having me.
Thank you.